My name is Javier Echenique. I'm the CEO of General Prognostics. We call ourselves GPX. And today, I believe we're going to talk a little bit more about CardioID, our first product. The issue with heart failure, it's quite a widespread issue. There's over 7 million heart failure patients in the US, and they generate just a lot of cost and burden because they're always headed back into the hospital. They're being readmitted to the hospital at very high rates, higher rates than other diseases. This is because they're not appropriately monitored at home. And sometimes their conditions change while their doctor's not aware of their condition and they're not aware of their condition. And as a result, the doctor can't adjust their medicines. If the doctors could adjust their medicines, it could stabilize the patient's condition, keep them out of the hospital. So what this means is that we have insufficient remote monitoring. The technologies out there right now are not meeting the needs of enough patients. And so we'd like to change the way remote monitoring is done so that it could apply to more patients, more heart failure patients out there. CardioID is the first product that General Prognostics is working on. And it uses our technology that we call bloodless blood testing. And so what CardioID does is actually has heart failure patients wear our wearable and use our app. And we collect information about the patient's heart rate trends, their sleep trends, their activity trends. And this information goes into our cloud and is translated into the patient's NT-proBNP, which is a vital blood biomarker used by cardiologists to understand the status of heart failure patients. So what our system does is by collecting all that information, it could tell the patient's doctor if there's been a significant change in NT-proBNP without even doing a blood test. And this is indication that a patient's status is changing and the doctor should intervene before the patient ends up in the hospital. So that we use a wide variety of data. Much of it is passively collected via a smartwatch. So the smartwatch collects trends about patient's heart rate, arrhythmias, heart rate variability, their levels of activity, if they're athletic, if they're sedentary, and also the quality of their sleep. Are they sleeping a lot? Is it in deep sleep or light sleep? We monitor their weight and their symptoms. We monitor their 6-minute walk times. And during our clinical studies right now that we're active in, we're also in parallel collecting patients' blood test data, their NT-proBNP, creatinine, and potassium. And we're using this to refine and further build our algorithms to validate our algorithms' performance. And this would allow us to carry forward into a pivotal FDA study for FDA clearance. So I mentioned earlier that heart failure patients' conditions can change quite rapidly, and often this happens without the patient knowing anything about their change. By the time they become symptomatic, it's quite late to change their condition, and they're probably ending up in the hospital. So the idea here is to provide early warning for the patients and the doctors that things are going in the wrong direction. And by knowing that, the patient and the doctor can adjust and avoid hospitalization. And these hospitalizations are disastrous for patients. It stops everything in their life. If they're working, they can't be at work. The bills that come out of this, especially in the US, are extremely high. And so, and the patients fight for their lives. Many of them will die in the hospital after being hospitalized. So the idea is to first remove this huge burden on the patients from hospitalization and further improve their mortality. In other words, to help them live lives more successfully. For doctors, this allows doctors to apply their skills more efficiently, to identify patients that are not stable and intervene accordingly. Right now, they're kind of flying blind with patients who don't have monitoring systems. One of the beauties of CardioID is that it's non-invasive. It's dependent on wearable technology. We're currently on one platform, but we expect to expand to several popular wearable platforms in the future. And so the idea is that we're turning the ubiquity of wearables into a regulated and powerful device for medical management. And because this is not an implanted product, the cost basis is pretty low. And so one of the things that really motivates us is that we're not just creating a solution for rich economies in the Western world. We're creating a solution that once it's been validated and proved here, it can be implemented at scale in more developing economies where people just typically don't have the money to have advanced monitoring and advanced care. And we aim to have a solution for all the world to use.